The skin is the largest organ system in the body. It covers 20 square feet of surface area in the average adult. The skin guards the body from environmental stresses such as trauma, pathogens, and dirt, and adapts to other environmental influences such as heat and cold. An accurate description of the skin lesion may help lead to the correct diagnosis. In describing skin lesions, consider the following. Lesion type, sometimes called primary morphology. These are the different types of primary and secondary lesions. Size, demarcation, whether it is well demarcated or not well demarcated. Shape and configuration of the lesions, which will be discussed later. Texture, some skin lesions have a visible or palpable texture that suggests a diagnosis. Location and distribution is important to note whether the lesions are single or multiple, which particular body parts are affected, such as the palms or soles, scalp, or the mucosal membranes. Is the distribution random or patterned, symmetric or asymmetric? Are the lesions on sun-exposed or protected skin areas? Although few patterns are pathognomonic, some are consistent with certain diseases. The color, which may also suggest certain diseases. Let's discuss first the common shapes and configuration of skin lesions. Describe the lesion. So this is an annular lesion or a circular lesion which begins in center and spreads to the periphery. Examples are tinea corporis or ringworm and tinea versicolor. How about this lesion? These are confluent lesions. These are lesions that run together in cases such as urticaria or hives. How about this lesion? These are discrete lesions, wherein these are distinct individual lesions that remain separate. Examples are acrocordon or skin tags, and in some cases, acne. How about this lesion? These are gyrate lesions. These are twisted, coiled, spiral, and snake-like configuration. Describe the lesions. The lesions are grouped or in clusters, such as vesicles of contact dermatitis. How about this one? The lesions are in linear fashion. What are these? These are target lesions or iris lesions. These are concentric rings of color in lesions, as seen in patients with erythema multiforme. How about this one? It's a zosteriform configuration. These are linear arrangement along a unilateral nerve root, as in cases of herpes zoster. Let's proceed with the primary skin lesions. What is a primary skin lesion? Primary skin lesions is the immediate result of a specific causative factor. Primary lesions develop on previously unaltered skin. A macule is solely a color change, flat and circumscribed, of less than 1 centimeter. Examples are freckles and flat nevi. A patch is a macule that is larger than 1 centimeter. Examples of which are Mongolian spot, vitiligo, and cafe au lait spot. A papule is something you can feel. It is solid, elevated, circumscribed, less than 1 centimeter in diameter, and is caused by superficial thickening in the epidermis. Examples are elevated nevus or a mole, lichen planus, molluscum, and wart or verruca. Plaques are papules that coalesce to form surface elevation wider than 1 centimeter. A plateau-like disc-shaped lesion, where examples are psoriasis and lichen planus. Nodules are solid, elevated, hard or soft, and larger than 1 centimeter lesions, and may extend deeper into the dermis than a papule. Examples are xanthoma, fibroma, and intradermal nevi. Wheals are superficial. It is raised and erythematous, slightly irregular shape due to the edema. Examples are mosquito bite, allergic reaction, and dermographism. Vesicles are elevated cavity containing free fluid up to 1 centimeter. Clear serum flows if the wall is ruptured. Examples are herpes simplex, early varicella, herpes zoster, and contact dermatitis. Bulla is larger than 1 centimeter and usually single-chambered or unilocular, superficial in epidermis, thin-walled, and ruptures easily. Examples are friction blister, pemphigus, burns, and in cases of contact dermatitis. A cyst is an encapsulated fluid-filled cavity in the dermis or subcutaneous layer, tensely elevating the skin, an example of which is a sebaceous cyst. A pustule contains turbid fluid or pus in the cavity. It is circumscribed and elevated, examples of which are impetigo and acne. Now let's proceed to the secondary skin lesions. Secondary skin lesions result from a change in a primary lesion from the passage of time or an evolutionary change. Take note, combinations of primary and secondary lesions may coexist in the same person. Such combined designations may be termed as papulosquamous, maculopapular, vesiculopustular, or papulovesicular. Crusts are formed when the thickened, dried-out exudates are left after the vesicles or pustules burst or dry up. Color can be red-brown, honey, or yellow depending on fluid ingredients such as your blood, serum, and pus, an example of which is impetigo, which has dry, honey-colored crusts. Scales. Scales are compact, desiccated flakes of skin, dry or greasy, silvery or white, from shedding of dead excess keratin cells. Examples include psoriasis, which are described as silvery scales, and seborrheic dermatitis, which has yellow and greasy scales. A fissure is a linear crack with abrupt edges. It extends into the dermis. It can be dry or moist, an example of which is chelosis at the corners of the mouth. An erosion is scooped out but with shallow depression. It is superficial. Epidermis is lost. It is moist but there is no bleeding. It heals without scar because erosion does not extend into the dermis. An ulcer is a deeper depression extending into the dermis, and it is irregular in shape and may bleed. It leaves a scar when it heals. An excoriation is a self-inflicted abrasion. It is superficial, sometimes crusted. It results from scratches due to intense itching, examples of which are scratching due to insect bites, scabies, dermatitis, or varicella. Scars are formed after a skin lesion is repaired, normal tissue is lost and replaced with connective tissue. This is a permanent fibrotic change. This image shows a hypertrophic scar. In atrophic scar, the resulting skin level is depressed with loss of tissue. There is thinning of the epidermis, as seen in patients with striae. Lichenification is formed due to prolonged, intense scratching, which eventually thickens the skin and produces tightly packed sets of papules. A keloid is a benign excess of scar tissue beyond the sites of original injury from surgery, acne, ear piercing, tattoos, infections, or burns. It looks smooth, rubbery, and shiny. As mentioned earlier, when describing a skin lesion, always consider the following: lesion type, the size, demarcation, shape and configuration, texture, location and distribution, and color. Thank you for listening.